Hello everyone, I'd like to welcome you to my online HR training presentation. We have another new topic for HR training. Today we're going to learn about reporting of suspected abuse and neglect. The objectives here are to see the ways which we can detect and recognize reportable situations of abuse and neglect in home health care. We will know how to report allegations of abuse and neglect and how to prevent and create awareness for abuse or neglect. What is abuse? Abuse is the improper usage or treatment of an entity, often to unfairly or improperly gain benefit. Abuse can come in many forms, such as physical or verbal maltreatment, injury, assault, violation, rape, unjust practices, crimes, and other types of aggression. Neglect. It is defined as a breach of duty or form of substandard care that results in harm to a patient. There are 7 types of abuse. It is physical, emotional, verbal, economic, mental, sexual, and spiritual. And as the picture indicates, the person is trying to prevent himself from the various types of abuse. Physical abuse occurs when force is used against a patient or employee, resulting in some type of physical pain, impairment, or injury, striking with or without an object, hitting, beating, pushing and shoving, shaking, slapping, kicking, pinching, burning, inappropriate use of drugs and physical restraints, force feeding and physical punishment of any kind also are examples of physical abuse. Sexual abuse, non-consensual sexual contact of any kind with a person, sexual contact with any person incapable of giving consent. Examples are unwanted touching, all types of sexual assault such as battery, rape, sodomy, coerced nudity, sexual explicit photography, forcing individuals to watch sex acts, showing an elderly person pornography, forcing the elder to undress. Emotional abuse. It occurs when patients or employees are treated or spoken to in ways that cause them stress or emotional pain. It can be both verbal or non-verbal. Verbal assault, insults, threats, intimidation, humiliation, harassment, treating an older person like an infant, isolating an older person from his or her family, friends, or regular activities, giving an older person the silent treatment, or forced social isolation. Non-verbal psychological abuse includes failing to acknowledge his or her needs, menacing or terrorizing behaviors that are meant solely to scare a patient or employee, forcing a patient or employee into isolation from family and friends. Spiritual abuse. When a person in religious authority or with a unique spiritual practice misleads and maltreats another person in the name of God or church or in the mystery of any spiritual concept. Spiritual abuse often refers to an abuser using spiritual or religious ranks in taking advantage of the victim's spirituality, mentality, and passion on spiritual matters by putting the victim in a state of unquestioning obedience to an abusive authority. Mental abuse is a form of violence that affects the mind, often leaving the abused feeling worthless and lacking empowerment. Economic abuse is a form of abuse when one intimate partner has control over the other partner's access to economic resources, which diminishes the victim's capacity to support him or herself and forces him or her to depend on the perpetrator financially. Neglect. The refusal or failure to fulfill any part of a person's obligation or duties to an older person. Failure of a person who has fiduciary responsibilities to provide care for an older person. For example, paying for necessary home care services. the failure on the part of an in-home service provider to provide necessary care. Examples will be refusal or failure to provide an older person with food, water, clothing, shelter, personal hygiene, medicine, personal safety, other essential needs. Either implied or agreed self-neglect covers a wide range of behavior, neglecting to care for your own personal hygiene, health or surroundings, and can include behaviors such as hoarding. Self-neglect is also defined as the inability, intentional or non-intentional, to maintain a socially or culturally accepted standard of self-care, with the potential for serious consequences to the health and well-being of yourself and sometimes your community. The self-neglect, the behavior of an older person that threatens his or her own health or safety. Examples are refusal or failure to provide himself or herself with adequate water, food, clothing, shelter, personal hygiene, medication, safety precautions. Who commits abuse? It can be both men and women, adult children, and family members. The abuse comes from this group more often than any other group. It can be also caregivers or care providers, strangers, and even spouses. Why are older people more vulnerable to abuse? This could be due to medical illness like dementia, social isolation, mental impairment, caregiver stress, cannot fend for themselves emotionally or physically, and they become dependent on their care provider. What are the warning signs of abuse in home care? Bruises, pressure marks, broken bones, abrasion, and burns may be an indication of physical abuse, neglect, or mistreatment. Unexplained withdrawal from normal activities or sudden change in alertness and unusual depression may be indicators of emotional abuse. Bruises around private area or on body can occur from sexual abuse. Sudden changes in financial situations may be the result of exploitation. Bed sores, unattended medical needs, poor hygiene, and unusual weight loss are indicators of possible neglect. Behaviors such as belittling, threats, and other use of power and control by spouses are indicators of verbal or emotional abuse. Strained or tense relationship, frequent argument between the caregiver and the older person are also signs. So if you notice changes in personality or behavior, you should start to question what is going on. How can we prevent abuse in home care setting? We can do so by educating the older people, professionals, caregivers, and the public on abuse, which is critical to prevention. We can call and visit older loved ones, catch stress early on, provide respite to those providing care, report any suspicions which you may have, and the World Elder Abuse Day being held on June 15th, we should wear a purple ribbon in support against abuse and create awareness. Reporting abuse. When you come across abuse victims who are being abused or neglected, you need to report it immediately. Call 999 if the person is in immediate danger. Report concerns to appropriate government authorities. Raise concerns through established complaints and reporting mechanism, and you will call police if necessary. I'd like to thank you for your time and participating in this online HR training presentation. Please fill out the forms, the feedback form, and the quiz, which is part of this HR presentation. So attached is the feedback form and the quiz to be completed and to be returned back so we can record them. If you have any questions for this presentation, you can add them on the email and we will reply back to you. So I look forward to receiving your replies and to receiving the completed quiz form and the feedback form. Thank you very much for attending my online HR training presentation.